for help from the public around the issue of access to personal protective equipment. And that's a really, there's a dire shortage of that equipment. It's being rationed. Protective equipment like the N95 mask is not readily available, or available in situations that any of the healthcare unions would consider necessary to actually protect the workers. And of course, the problem with that is that the populations that we're dealing with in long-term care and in the hospital sector have very frail immune systems, and people can contract this virus working in the environment of close proximity to these COVID patients, and asymptomatically they can be passing that virus along to coworkers who are in short supply, but also to these residents. And 69 of Ontario's long-term care facilities are now in outbreak, and 15% of all the cases are now in Ontario long-term care. The reason that there's such a supply problem is because Ontario did not plan for this eventuality. They did not order enough equipment. They have shortages of the N95 and other protective equipments. And now, with all jurisdictions around the world competing, they're finding it very difficult to get this equipment. And it materializes in different ways. We have the lowest level of testing anywhere in any country with a developed economy. And countries which are testing, like West Germany and South Korea, have a much lower death rate because they're able to identify cases. So what could we do about this problem? Well, four unions called on the Ontario government yesterday to order industry to ramp up production of testing kits, ventilators, gowns, masks, and gloves and other equipment. And the Chinese government was able to set up factories to pump out masks in 2 weeks. And the Ontario government has been watching this train wreck happen now for 2 months and has not ordered industry. It's been cajoling, it's been encouraging, it's been lauding entrepreneurship, but in terms of actually ordering that some of these vacant facilities as exist in Oshawa be turned up using the tool and die capacity we have, the engineering know-how we have to actually pump out this equipment, that has not been forthcoming. And that would be such a fantastic development if we used the unused capacity to and turned it around, which we could do quickly to direct this equipment to the front line. Otherwise, you're going to see the rate of infection of healthcare workers increase dramatically, something like approaching the rate of paramedics in New York City who use the same precautions we do. 20% of them are off with COVID. And you're going to see the public start to fall also, especially when they come into these facilities. So it's a great effort you're mounting with Green Jobs Oshawa, and we're very grateful for it. Thank you.
Thank you very much, Michael. I think that really highlights the life and death nature of the crisis that we're talking about. And I'm now going to ask Rebecca Keetch, who is an activist with Green Jobs Oshawa and a laid off worker from GM in Oshawa, to talk about Green Job Oshawa's proposal. Rebecca?
Hi. So Green Jobs Oshawa is calling on the Prime Minister to immediately order the production of essential medical equipment and supplies at the Oshawa GM complex and related part supplier facilities. This should be the first step towards establishing a publicly owned manufacturing center that could supply strategically necessary goods in times of crisis. The Premier of Ontario has noted the importance of production in Canada as global supply chains break. And Chrystia Freeland, Deputy Prime Minister, has noted it is really a wild west when it comes to buying medical supplies right now. Medical supply shipments have been delayed, smaller than anticipated, and in some cases missing entirely. And everyone is aware of the chilling effect and continuing threat Donald Trump has had on supplies coming in from the States. It doesn't need to be this way. Canadian auto and parts manufacturers are uniquely suited to assist in this crisis. They excel at logistics, supply chains, and ramping up production. However, conversion should not be left up to the goodwill of corporations. The government should order conversion and ensure the resources needed are directed to these endeavors. In order to accomplish this quickly and to the required scale, it must be mandated. We need the government to intervene in a methodical and planned manner. There are examples of auto and part suppliers pivoting production in a matter of days and weeks across the world, such as Chinese car maker BYD will be producing tens of millions of masks along with millions of liters of hand sanitizers. General Motors is producing ventilators at its Kokomo, Indiana plant for Ventec. General Motors is producing face masks at its Warren, Michigan plant. Ford has partnered with GE Healthcare and Aeron Corp to produce ventilators at its Rawsonville Components plant. However, we know production in another country does not guarantee our needs will be met here at this time. It is commendable that Ford Canada is producing face masks at its Windsor, Ontario plant, and Linamar, Magna, Martin-Rea, and ABC Technologies are working to build ventilators. And we are grateful to others that have started conversion. However, we must demand this production is immediately scaled up by the Canadian government and that GM is called to assist. There are millions of square feet of underutilized manufacturing capacity at the Oshawa complex and surrounding closed supplier units. There is an underutilized workforce of thousands in the Oshawa and Durham area thanks to GM ceasing auto production in Oshawa. Ontario has a very skilled, educated workforce that can rise to this challenge if we could only put social need before any corporate interest. We don't need hospital workers, long-term care workers, transit drivers, grocery and food supply workers, and every other person this country has now recognized as essential to be heroes, risking their life every day at work to help others. We need them to be able to confidently and safely go to work, knowing they have the proper personal protective equipment to keep them safe and their families safe. We need to do better, and we need immediate, strong, and bold leadership. The ideas Green Jobs Oshawa is putting forward make sense, and the demand is clear. We must start the manufacturing of necessary medical equipment immediately. We should make use of Oshawa to be able to securely source vitally necessary medical and other products for the future. We can also use a publicly owned manufacturing hub in Oshawa to prepare for the looming climate crisis. The lack of preparation for this pandemic is a stark warning that a Green New Deal must be launched now. We must do better. And I'd just like to say thank you to all of the workers that are still, we need to recognize that people are working under incredibly stressful situations now, and it doesn't need to be this way. Thank you.
Thank you, Rebecca. I think that really sets out what is part of the solution, and it's something that needs to be done immediately. Next, I want to ask, we want to hear from Patty Coates, who's the president of the Ontario Federation of Labor. Patty?
Thank you, Tony. As Tony said, my name is Patty Coates, and I'm the president of the Ontario Federation of Labor. The OFL represents 54 unions and 1 million workers fighting for the rights of workers, whether they are in a union or not. The labor movement of Ontario stands with you in this initiative. Our province is facing an unprecedented crisis because of COVID-19, and we have an opportunity for Oshawa to be part of the solution. Our healthcare system is already strained by decades of underfunding. Workers and their unions have been sounding the alarm of underfunding in the healthcare system as the Conservatives aggressively cut funding. Now, our province is faced with shortages of life-saving personal protective equipment and ventilators. Our critical healthcare workers are incredibly important to us in our communities. And they can't wait for PPE or be forced to ration this vital equipment so they can do their job safely. Severely ill patients can't wait for life-saving ventilators. Just a week ago, on March 31st, the Premier stated, we're ready to mobilize our manufacturing to help the entire country, and we want Ontario to become the workshop of Canada. Premier Ford also said, extraordinary times call for extraordinary efforts. It's time for extraordinary efforts. It's time for more than just mobilizing. It's time to put the money where it will be most effective. And let's do it right here in Oshawa. Oshawa is home to skilled, ready, and able workforce that is eager to work. And instead of overriding collective agreements of our essential frontline workers, Doug Ford has an opportunity to work with unions and community leaders and move towards the manufacturing of needed equipment now and right here in Oshawa. Instead of ordering corporations to shift and retool their businesses temporarily, instead of waiting for orders from 3M to clear the US and Canada border, instead of waiting for shipments from other countries, Oshawa's GM facility can become Canada's #1 manufacturer of essential personal protective equipment and ventilators right now. And this is good for the community of Oshawa. This is good for Ontario and good for Canada. It is good for the frontline workers who are putting their lives at risk so all of us can stay safe and healthy. I call on all levels of government to make this happen, manufacturing PPE and ventilators that are Oshawa, Ontario, Canada made. And when we move out of this immediate crisis, more than ever, we need the manufacturing sector to continue to thrive. It will, right here in Oshawa, if the right decisions are made now. We know that the need for PPE will always be there. This pandemic has amplified the need for supplies to be easily and readily available right here in Canada. We can also play a key role globally by manufacturing essential PPE and ventilators. The ventilators Ontario needs can be made right here. The GM plant must be repurposed to help in the COVID-19 crisis and fight. All workers need safe and healthy workplaces. In these times, that means access to the equipment that will protect workers and communities they are supporting and the patients from contracting COVID-19. We've been told to stay home, to wash our hands often, to only go out for necessities, but our province could and must go further. Critical next steps, resources, and protections are required, and they're required immediately. Ontario must legislate 21 paid emergency leave days for all workers so they can stay home when they are sick without facing financial hardship. It must provide free health care for all, regardless of status. It must ensure full job protection for all workers. These are just a few of the recommendations the OFL has provided to the government during this crisis. We hear from workers and their unions. We know what workers are calling for, and they're calling for greater protections. Our province must protect the workers who are on the front lines of this fight, because these workers can't stay home like you and I. Every day they wake up and they go to their jobs where they face shortages of protective equipment. These frontline workers are the people who keep our communities safe, functioning, and fed. To make sure that Ontarians have the critical medical equipment they need, it is time to bring the Oshawa Assembly Facility back into action. Let's put it to work for the people of Ontario. The labor movement stands with you in this fight for the health and safety of every Ontarian. Solidarity, and thank you.
Thank you, Patty. We're incredibly grateful to have the solidarity and support of the labor movement in what we're advocating. We know that workers are a majority in our society, and as a voice for those workers, we appreciate your support very much. Next, I'm going to call on James Hutt, who does labor and climate justice work with the LEAP. James?
Thank you, Tony. The LEAP is honored to be sharing this virtual stage with the OFL and Green Jobs Oshawa and the hospital division of the Canadian Union of Public Employees to present this very practical and timely solution. Right now, we're living in a very unprecedented time, which everything we've kind of taken for granted in the past has been upended. One thought I often have is that COVID-19 has shown who actually creates society in our value and COVID-19 has shown who creates value in our society. That is, it's not CEOs and investment bankers, but it is healthcare workers. It's grocery store workers. It's manufacturing workers who make sure that we all have the safety and supplies that we need. We're seeing this solution brought forward from healthcare workers, from manufacturing workers in a time of crisis when we need it most. We know that there's an intense medical shortage of medical equipment that healthcare workers need to simply do their jobs. It's one thing, as Rebecca mentioned, to call healthcare workers heroes, but we actually need to make sure that they are not putting themselves at risk, that we are not further risking our society by not providing the equipment they need. And so in this moment of crisis, I applaud Green Jobs Oshawa and the healthcare workers who are putting forward this very simple, straightforward, and needed solution. We know that a couple weeks ago, Trudeau called for businesses to retool or to switch to manufacturing medical equipment. Again, as Rebecca and others have said, it's not enough to rely on the goodwill and the benevolence of corporations and CEOs. We will not get there fast enough. There's a Novo textile factory, Novo Garments, I believe it's called, in Coquitlam, which is trying to retool to produce medical masks. They're a private company. They've ordered machinery from China to do this. And it's commendable. It's about a 20,000 square foot factory, and they're going to start turning out masks. But they've been waiting for equipment to arrive from China. And they're still not up to capacity. They're still not going to meet demand. And it's just one factory. This shows that we need the government to play a strong role, to scale up, and to ensure that we can actually meet the demand for medical supplies here in Canada, which is exactly what the GM Oshawa plant can and should do. We know that the Oshawa complex, which is, quite frankly, one of the largest plants in all of North America, one of the largest auto manufacturing plants, it's sitting about 90% empty right now. 90% of that space is just going to waste ever since General Motors pulled up after 100 years in Oshawa and relocated, putting about 15,000 people out of work, 5,000 direct people at the plant and 10,000 throughout Southern Ontario. So in the middle of this crisis, we have a gigantic factory sitting empty and over 10,000 workers with skills and ability that we need to address this crisis. And it's right there. And healthcare workers and manufacturing workers have presented this presenting this ready to launch solution to get us working on COVID-19. Now, we know that it's going to be all hands on deck. We need the government to be scaling up these efforts and to be directing it, to putting workers back to work in good, well-paying, unionized jobs, to actually create the services and the value that we need in society. And most importantly right now, that's masks and PPE. So we're proud to stand with Green Jobs Oshawa, the OFL, and CUPE in calling for this. It's part of a cornerstone of what the LEAP is calling a people's bailout. That is, instead of bailing out banks and corporations and CEOs, this time it needs to be workers and the planet who are actually getting stimulus packages. And the way we're thinking about this is we're thinking about a people's bailout that does three things. One, it responds. It meets the immediate life or death needs of frontline workers and all those whose lives have been upended by this crisis. Two, it helps recover. That is, it makes sure that stimulus spending builds the scaffolding of a zero carbon, full employment economy. And three, it helps to reimagine our society. We make sure that we make sure to transform the economy to prioritize safety and stability for all, not just the 1%. And so I've been involved with the Green Jobs Oshawa campaign for a while, and I think it's a brilliant solution. We can immediately put people to work making masks, but in the long run, there is so much untapped potential in this plant and among the workers in and around Oshawa. We know that they can easily retool to produce electric vehicles and battery-powered electric buses. We know that we face a climate crisis on top of the economic and the pandemic right now. We need to lower emissions, but we also need to put people to work in good paying unionized jobs. Nationalizing, that is taking the plant into public ownership, would create 13,000 unionized, well-paying jobs to produce the things that we need, things that actually create value in society. Right now, we can start immediately responding to the crisis to produce masks and manufacturing, masks and medical equipment, that is. And then we can go from there to recover, to start producing electric vehicles and buses. Now, we know that, for example, Canada Post has the largest vehicle fleet in the country. And the postal workers have gone to Oshawa and said, we would love this. We would love to actually use electric vehicles to deliver the mail. And why shouldn't they be manufactured right here in Canada by a unionized workforce instead of getting them from overseas? So that would help us recover from the crisis. We know there's a large market right there, or in getting buses for every city and town across the country. And finally, to reimagine our society. We know that we can go from this and to create a more just society for all. And that means public ownership of the plant. That means making sure that we have an adequate medical supply of masks and ventilators and PPE for the long term. It means having a public company to actually manufacture that stuff here and to employ thousands of workers, not just in Oshawa, but around the country. Part of the reason we're in this crisis is because we've lost a lot of our manufacturing capacity. We know that 15,000 people in Oshawa have just been put out of work. So we have the tools, we have the plant, we have the capacity to respond, recover, and reimagine from this crisis. And the last thing I'll say is just that our collective health depends on the health of everyone. That means the health of every health and support worker, of every manufacturing worker, and making sure that they all have the equipment and tools they need to do their job. It means ensuring full employment and job protections, as Patty mentioned, for the long term. And it means restructuring our society to ensure safety and stability for all, not just the 1%. So the LEAP is calling for a people's bailout, and we applaud this initiative by Green Jobs Oshawa. Thank you.
Thanks, James. I just want to let people know that we do have a petition that will send your voice to Premier Ford and Prime Minister Trudeau. It's on our website, greenjobsoshawa.ca. We encourage people to sign the petition, circulate it, and build as much public support as we can. I guess at this point, we're going to be open for questions from journalists or others to any member of the panel, and we'll try to field those questions. I think James is going to be monitoring what questions come in.
Yep, so I see a couple here in the chat. I'm gonna take a moment to try to compile them and post them. In the meantime, I'll turn it over to Valerie McDonald, who I'm gonna turn your microphone on. So Valerie, hi. Oh, are you there, Valerie?
There. Can you hear me now?
Yes, we can.
Okay. So my question is, how quickly could this take place in the vacant GM quarters, and to bring the workforce that is 5,000 predominantly and 10,000 further afield in suppliers? How quickly do you see this kind of a massive reaction taking place and actually producing? And I'm not sure who could answer that for me.
Thank you, Valerie. I'll take one more question from the chat and then turn it to panelists. So one question we have from Kate Stoller is, who will pay to retool operations, the federal or the provincial government, both? And any idea about how much it would cost, and again, how long it would take? Who would like to speak to that? Michael?
Well, I'll just say that the Chinese government was able to set up these factories in Wuhan in 2 weeks. And, you know, they're making fiber cloth masks, you know, is not something that's going to be enormously complicated. So, you know, we would be imagining that this could be turned around almost immediately. And don't forget, the government has given itself emergency powers. It could order this to happen. And as to the cost, Ontario is paying like 3 times the value of these products now on the open market. So it would wind up saving a considerable amount if there was local production.
Becca?
So I think it's worth noting. So Michael just mentioned what's happened in China, but we know that in the States, in Warren, I think it was 2 weeks that they were able to get up and running and converted, and it'll be, I think, in total a month before they're producing thousands of masks. We also know that the Ventec, I think it's been less than a month that they have prototypes going at the GM plant in the States. So this could happen very quickly if there's the will. Now, I mean, of course, you're going to have to source the necessary equipment and get a plan. But I mean, that's what the beauty of our auto supply and auto manufacturing is. They are quickly able to deal with challenges like this. They are quickly able to source materials. They have great supply chains, and they have a lot of ingenuity when it comes to making things happen. As far as costs are concerned, I think it would depend on how it's done. If you were talking about retooling right now, well, is the government getting it for free? Are they paying for the product and the work? These are questions and things that would have to be sorted out in a reasonable manner. And I think it's very clear that the government would have to be helping with retooling and stuff to meet the immediate demands that we need.
And if I could just step in here too, as I said before, I think this is something that we need to think further than just the end of this first curve of this pandemic crisis. We need to think into the future. We need to think of what our economy is going to look like. And there's always going to be a need of personal protective equipment, ventilators. And if we, as they say, this could take a year to 2 years, and we could cycle through a number of these situations, that I think the cost really is, I think the health of our community, to ensure that the equipment is there, is a cost that we do want to put forward. To me, it doesn't really matter what that cost is, because the cost of lives are even greater than and priceless than retooling and refurbishing a facility in Oshawa. I think it's really important that this isn't just a temporary solution, that this is a permanent solution going forward.
Well said, Patty. A couple other questions here I have are, the federal government had no problem purchasing a US-owned pipeline company when it appeared that those pipelines might be permanently idled. Why, when faced with this crisis, would the feds not step in and buy the Oshawa plant from GM Canada and repurpose it? A follow-up question to that is the plant too large? Could it be easily repurposed for medical equipment and car parts? And how does scale play in? And then one other question I saw here in the chat is, do you have a sense of whether the equipment is on site, or would you need machinery from overseas to do this? Michael?
Well, just on the sense of urgency, I mean, if you think the provincial government is fairly relaxed with respect to its approach to COVID, the federal government is extremely laid back. You get none of the sense of urgency that we're actually at war against a virus that's killing hundreds of people already in Canada, and is going to go on to kill thousands, and is going to affect us all in a very, very profound way. The federal government has been hopeless at pandemic planning. It has not ordered industry to make this equipment. It has not intervened in the economy in any directive way. It has not taken charge. You've got Governor Cuomo in the United States asking the president to use the federal war powers to order GM to do industrial production. The next day, they order industrial production up here. Do you think we watch that example and learn anything? Not at all. Not at all. So, to Mr. Trudeau and the federal government, it is time for the federal government to treat this as though it were a wartime situation, and to order industry to tool up and to produce this equipment. Because literally thousands of people are going to die here, and a lot of people who don't need to, and a lot of healthcare workers who don't need to, because we simply don't have the equipment, because we don't have the testing kits, because we don't have the ventilators to put people on when they can no longer breathe. I mean, these are fundamental things, and it's one thing if we're failing because despite doing everything in our power, trying everything, pulling every lever, making every order, things aren't working. It's another if we're basically just trying to secure supplies out there on the open market and not lifting a finger in terms of trying to get our own domestic capacity going.
And if I could just add something, I noticed that there was a question about what about grocery workers, and I think this is something that's truly important. You know, right now they're focusing on healthcare because we don't have enough PPE to even cover all of the healthcare workers that we have in our hospitals and long-term care centers, and those that are the personal support workers that are going from home to home. And we have our grocery workers, we have our transit workers, we have our, many of our municipal workers that are still out there working, that are in the public. And, if we could, retool and bring the Oshawa facility up to be able to make enough of these, of the personal protective equipment that can provide that protection to all of the workers that we consider critical workers and frontline workers during a pandemic.
Rebecca?
So I think there's a critical component of this is that we're asking the government to order production. We're not asking the government to try to ask people to step forward. We want them to order production. And with that ordering would come access to resources to make things happen. As far as, is the GM plant too big? Absolutely not. You don't have to use the entire 10 million square feet of production. You can use whatever portion of it makes sense to use in this time of need. As you know, is there a comparison to them bailing out the pipeline? I don't know. Like, I mean, what we're talking about is what do we prioritize right now in this moment as what needs to be done. And I think protecting Canadian citizens needs to be prioritized, and that the money should be found to do that, and the political will should be found to do that. Is the material and equipment on site? I don't know that it's all on site, but what I do know is that Ontarians are experts at manufacturing, that we have been for decades, and that we have tool and die, we have access to resources, we have engineers, we have people to work on the lines. We can make it happen if there's a political will to get it done.
Well said. That was the last question I saw, so I think I'll open it up for any last final comments from the panelists before we sign off. Any closing remarks?
Yeah, I've got a, sorry about my cat. I apologize. Can't keep them off the desk. So this isn't just about healthcare workers. This is about everybody, right? If you are a healthcare worker and you're going to work by public transit, the transit drivers need to be protected. If you are a person who's going to the grocery store, you need the grocery workers to be protected. If people are working in warehouses packing skids so that groceries will be on the shelves at stores, those people need to be protected. So this is, I mean, when we're talking about the scope of need of protective personal equipment, it's not just for doctors who are rationing it already in hospitals. We need to take the necessary steps to make sure that people aren't ending up in the hospitals and overwhelming the healthcare system there. There's an overwhelming need for all of this. And I mean, if you're talking to healthcare workers who are saying that they have limited access to masks, and you talk to somebody who's gone to a store to try to find masks or gloves or hand sanitizers out in the public, there's absolutely nothing. Like, we need to have access so that everybody can protect themselves. And it's not, you know, healthcare workers are taking the brunt of this because they're face to face with the sick people. But we need to make sure that everybody else isn't passing it on and isn't catching it just by keeping our society running. So I'm so appreciative to everybody that still works. And I mean, demanding that and ordering us to use our skills and opportunities and our expertise in Ontario to manufacture what we so desperately need right now, I think is just a common sense approach. Thank you.
Tony?
I just wanted to underline that we know how quickly production can be undertaken, because we've seen examples like Warren, Michigan, and Kokomo, where General Motors, when faced with a government order in the United States, sourced the equipment and designs and supplies that they needed and had production going in a week or 2 weeks, depending on what was being built. That can be done. And it's absolutely shameful that General Motors in Canada, which took $11 billion of public money not very many years ago, has not stepped forward to do anything. Obviously, the government needs to order them to do it. And GM Oshawa is the largest available, at the moment, almost entirely empty facility that could be used. It needs to start today. It's immediate. The need is immediate. But doing it in Oshawa would also mean we would have the very best possibility of constructing something that would be useful for the future and for the crises that are going to come in the future, that we know are going to come in the future.
Patty, Michael, any final comments?
No, I just echo what everyone else has said. I think this is something that we need to do immediately. We can't wait for this, and we need to call on all governments to mandate this so that we can get the necessary equipment to the people who need it.
I would just like to remind people again that we have a petition, greenjobsoshawa.ca. You can find the petition. We encourage you to sign it and circulate it. We need you to be calling your provincial and federal representatives, write letters to the editor, do whatever you can. The need is immediate, and we need the maximum public pressure on our government leaders to take the action which we know that they should be doing right now. So I want to thank everybody who's watching this or participating in this. I really want to thank James and Patty and Michael for their support. Thank Rebecca for her really clear explanation of what we're advocating. And please, everybody, lend your voices and make this the biggest movement we can so that we can get some action immediately. So thank you all very much.
Thank you.
Thank you.
Thank you. Take care, everybody.